Hello, everybody. Good morning, good afternoon, good evening to everyone in Western Massachusetts area, or in the Massachusetts area, or just if you're tuning in from around the world. Hi, I'm Karlos Reyes. I'm a community health worker, and I work at Springfield Square One, and I deal and work with families and children specifically affected with lead poison in our area here in Western Mass. And so we created this podcast, as you know, and also the YouTube channel, as you know, to give information to the public, especially since there's a lot of racial inequities in this particular topic within our area, and people need to know the facts and really be able to advocate for themselves as well. So we're honored to be able to share information, and we're happy to be here. It's Monday morning for us. We're excited. Everyone has their coffee. Yay. Again, I'm Karlos Reyes from Square One, and I have my co-host, my colleagues, Kim, and I want to make sure I say this right, Mayende?
Yes, Mayende. Mayende. I am Kimberly. I'm the project coordinator here at the Public Health Institute for Springfield Healthy Homes. I provide education, training, promotion for Springfield Healthy Homes. Please follow, like, share our Facebook page, like our stuff. Yeah. I work with Mary Sally and Carlos here.
Yes, and don't forget to check out Square One as well on Facebook. And please hit that like and see what Square One has to offer for the community, as it is a family service company as well as Kim's organization and so on. So I also want to introduce Mariceli Vega from the Office of Housing. How are you, Mariceli?
I'm good, and you? Hi, everyone.
I'm good.
I'm working exactly with the LED program and Healthy Home here in the Springfield City Hall and Office of Housing, and I'm glad I'm here today.
We are happy to have you. Happy Monday. I see the florals on your jacket. You're giving me life. You're ready for spring and summer. Yeah. And we have Robert. How do I pronounce your last name? Demusis from the Office of Housing. Would you prefer Bobby or Robert? I don't want to.
Most people call me Bobby, but either is fine.
All right, cool. Thank you so much for being here with us again. Please introduce yourself and let the world know of your greatness.
So my name's Bob Demusis from the City of Springfield's Office of Housing. I'm the deputy director here. We oversee a lot of grants, but the grant we're going to talk about today, I'm the program manager for the lead paint hazard reduction grant.
Excellent. And I want to thank you again for joining us to speak about lead poison awareness, abatement, and what have you. First and foremost, before anything, I always like to check in with everybody. And a serious question: how did everybody wake up feeling today? Hopefully good.
Terrific.
It's good. It's
Kim,
Monday.
I'm waiting on that answer. Your face said different.
Yeah, I mean, it's Monday morning, but the weather is nice outside.
Kim, there's going to be viewers appreciating your facial reaction. They're like, I'm with her. So let's get into it. Lead poison, right? Lead poisoning, lead abatement in 2022. As we have discussed, it's still relevant. We're embarking, everyone, on the summer season. And I'm not complaining, but it's kind of a busy time for community health workers in my experience, and I'm assuming as well lead inspectors, because here's the thing: everyone starts remodeling, renovating, putting in that new kitchen, doing yard work, and so sometimes, as we know, this can cause lead poison, especially with the older homes here in Massachusetts. So I guess I just wanted to first ask you this, Bobby. Tell me once again in the world and everyone in the community listening about your role and the services that you offer.
So the city offers through HUD offers a free de-leading program for families with kids under 6 or households with a pregnant woman. They can be renters or owner occupants. They do have to be income qualified, but they're pretty generous income limits. It's 80% of the area median income. A family of 4 beginning on June 1st is around 73,000. I think a single person is like 52. So most people we can get them qualified. For an owner occupant, it's 100% free. We will go in, we will test every single surface in the home, identify where the lead hazards are, and pay to have a licensed de-leader eliminate those hazards, make the house lead safe for the children, also increases the value of the house, and it's all at no cost to an owner occupant. We can also help investor owners with no money out of pocket. And after 3 years, 75% of the cost is forgiven for those investor owners. So people who are renting should talk to their landlords, and if they don't have that lead certificate, they can send them our way.
Excellent. Isn't it something that we're still dealing with this in 2022? But as I mentioned earlier, with the older housing that we have here in the state and whatnot, there are no surprises, I guess.
Springfield has very, very old housing stock. I think it's like 70% of our homes were built before 1978, and that's when lead paint theoretically went away. It was banned in 1978, but it was still around. And so, yeah, it's definitely there. And Springfield's one of the highest communities for lead poisoning.
Absolutely.
And elevated levels.
Yeah, it's, recently we've been, I'll speak to this really quickly. We've been having a spike in cases, and that's for multiple reasons, and we can talk about that later, but it's still a relevant issue. What are some of the main sources of lead exposure that you and your team, or that you can speak of, that we're finding, especially here in the Springfield area or in the Western Mass area?
So, the stereotypical thing is kids eating the lead paint, eating the chips of paint. And that's typically not how it happens. Although they say, and I've never tasted it, that lead paint has a sweet taste to it. But where you're getting it is from the dust. You're breathing in dust. If you have an old wood window and that window goes up and down, especially like you said in the warmer weather, that friction creates dust, and that dust gets inhaled, or that child goes to the window to look out, as children are naturally curious, and their hands are in the window well, later go to their mouth. Window sills are, so while they're not eating it, a kid who's at a windowsill looking out, if that windowsill is right there, kids like to put their mouths on things, so that's a mouthable surface. Sometimes, it could be mom or dad works in a place and they're bringing the lead dust home on their clothes, and it's on the floor, and kids, are crawling and spend a lot of time on the floor, and then that hand to mouth goes. Again, with the older housing stock, old wood-sided homes will probably have layers and layers of lead paint on them, and as they peeled and flaked over the years between paintings, the lead can get in the soil. Yeah. And so when the kids are playing in bare soil, hands get dirty, but there's lead in it. Again, mainly I think it's hand to mouth. It's not actually ingesting it. A lot of hand to mouth and inhalation. I know when I was a kid, old 1900 house, where'd you sleep? And we didn't have air conditioners, so old wood window, where'd you sleep? Your head right by that window. So I breathed in that lead dust all as a child, I'm sure.
That's a really good point, especially with no AC back in the day. Alternative sources. I mentioned this a little bit earlier before we went on live, but are there any alternative sources, or what can you speak to that you have found recently or in the last couple of years as well? Because it's not just, as you mentioned, just the home. It could always be mom and dad bringing home lead dust or what have you from their place of employment, things of that nature, or the soil. Are there any alternative sources that have been a big impact in this area that you've seen?
So, we don't have the ability, because of HIPAA laws, to follow up after we've de-leaded a unit. So if there's a child with an elevated blood level, we go in, we de-lead it. Unfortunately, we're not able to track that. But I'm sure your organization and the physician, the pediatrician, would track it. If we've de-leaded the home and that elevated level doesn't come down, then we do have to investigate other sources, which could be water. There's old lead soldering in water pipes. Again, in the older pipes, that's lead-free solder now, but that can leach into the water source. So that's a common area. And then you have to look where else the children is spending time. Are they going to grandma's house, 3 days a week after school? And really have to search out if the removing the lead paint hazards don't bring that level down, then you've got to search for those alternative sources, sure.
As a supervisor of inspectors and what have you, and being someone in this field, what advice would you give towards families in terms of doing safe renovations? Just especially now where we're going into the season, as I mentioned earlier, where people are going to have more time to work in that backyard, or to remodel the living room or repaint the bedroom. So what advice would you on your end give for safe renovations and how to avoid these issues?
So there's a federal guidelines, if you will, called Renovate, Repair, and Paint, RRP. And you can get certified in that. I think it's like an 8-hour course. You can get certified, but it's very commonsensical, and you can just do a little bit of research and realize, if I'm just changing a door, I'm popping off hinges, I'm taking that door off and I'm putting a new door on. That's not disturbing any paint. It's not any friction. It's not creating dust. But if I'm going to take out one of those old wood windows and replace it, well, I've got to now take the frame out, and that's going to create dust. So if you're doing stuff yourself, you really want to do what the de-letters do, really. Maybe not to the extent that they do it, but you're going to put plastic down, you're going to kind of enclose the area so you can contain any dust you create. And then you really want to clean up well afterwards, which means wet mop, vacuum, and then wet mop. And that's typically what the de-letters do, but they do it with very high efficiency vacuums, and when we leave there can't be a trace of lead dust. We actually do take the dust wipes and send them to a lab, and if there's the tiniest amount of lead, then they've got to go back in and clean lead in the dust.
Absolutely. What is your what's your oh dear Lord, what is your insight on just inequities in terms of lead poison, de-leading, or leading abatement in our area? And I guess, you can speak on, if you'd like, racial inequities or anything that you've been finding or that you've noticed along the way. Is there that you can speak of, or speak to, I should say?
Sure. So Springfield's a low-income community. And I don't think there's a lot of, and so I guess I can't speak to the inequities, but I can speak to our community, which is a low-income, racially diverse community. There's not a lot of education about lead. People don't, they may have incidental information, but they don't realize how damaging it is. I grew up with it, so it's not that big of a deal. I think we see some of that kind of attitude. But I think you guys are a big help getting the word out. And especially getting the word out to, maybe I'm a well-off family, and maybe I'm a well-educated family, and I do know the dangers, and I have the resources to get my lead certificate and make my home lead-free. Well, in Springfield, our residents have a terrific opportunity to do that same thing, no charge. We will go in and make that house lead-free. And then hopefully they'll tell their neighbor and their other friends who have children of the same age. And we're really trying. It's a phenomenal grant. And it's a great way to use this money. And we want to, keep moving through the city and do as many units as we possibly can. Yeah.
Excellent. Thank you. I had a couple other questions, but at the same time I'm listening, and I should have just wrote them down as I did with my previous ones. So I got to say, on my end, on the community health worker aspect, and I work cohesively with other inspectors and what have you. We work as a team for the common goal of A, bringing down the blood level in the child, B, making sure that the home is de-leaded, as you mentioned, and also advocating or lending our help with finding financial resources, because de-leading can be, as we know, a very financial resourceful thing. It's not cheap. Let's just call it for what it is. Question, how long have you been doing this? How long have you been
finishing up our third year of this grant, and the grant is awarded in 3-year periods. So we said we would do 100 units in 3 years. And so we're approaching that now, and we're hoping it will be renewed again for another 3 years. Again, you meet your benchmarks. It's pretty much a standard thing.
How is it looking for renewal?
Sorry?
Are we at that point?
We're approaching that point. Sometime around the first of the year, we'll be applying, and we fully expect to get renewed. Particularly the American Rescue Plan money a huge chunk of it was given to this division of HUD. So they've got more money than they had 3 years ago when we won the grant. It is a competitive grant, but like I said, we have a huge need in Springfield, so that helps us with our application. And now we have the experience to show that we're doing the good work, and we fully expect that we expect the grant to be here for a long time.
That's awesome. Have your inspectors, and this is just off the top of my head, have they faced any adversity with landlords or anything? Is there anything that you like to share in terms of that? Because, you know, tenants do have rights, as we know, and everyone should definitely go look up the Massachusetts lead law, which does state that if there is a child 6 years of age or under living in a home that was built prior to 1978 and that home is leaded, that home must be de-leaded. And you know, it is illegal for a landlord to evict the tenant because the home has been found with lead. Has there been any adversities in your ends that you faced, or anything that the inspectors have faced with landlords who are not complying, or just any adversities at all?
So the actual lead law requires disclosure, no matter how old the person is. If I'm going to rent you an apartment, I'm supposed to give you an official notice that says, one, there is lead paint. No, there isn't lead paint. Here's a copy of my certificate. Or I don't know if there's lead paint. Nobody does that, at least in Springfield. Prior to this position, I was a code enforcement inspector. And that's where you'd see the adversity. Code enforcement inspectors can do what's called the lead paint determination for a tenant if there's a child under 6. That's where you would get the pushback from the landlords. The tenant wants to find out if there's lead there for the child. You find it. Now you've got to cite that landlord to de-lead the home. And of course, like you said, it can be costly. The landlords don't like to spend money if they don't have to. So that's where the pushback. In this program, they're coming to us. The owner occupants coming to us. They want us to come and find out where the lead is and get rid of it. Right. And even a landlord, they would have to come to us too. But again, no money out of pocket. So our partners are very cooperative because it's a home run for everybody, investor, owner, or the owner occupants.
No, that makes perfect sense. Absolutely. Absolutely. I just wanted to remind everybody, please don't forget to maintain, dust is a big factor. Children have the hand-to-mouth behavior, as we know. Sometimes some of us as adults have hand-to-mouth behaviors, especially when I'm eating ribs, okay? Or some good food. No, but seriously, so children have that hand-to-mouth behavior. You mentioned this earlier with soil and whatnot. And I just want to remind everybody, always just have people take off your sneakers when you're coming into the home. I know I make everyone take off their sneakers or boots or flip-flop, whatever, just so that we don't track in dirt into the home and what have you. Because again, even as something as simple as dad's boots, work boots, might have dust on them or dirt that could be leaded. Those should be left at the door, wiped down, because we know kids touch everything. So just a friendly reminder as well. Bobby, where can everyone in Springfield, Western Mass, or anyone who needs more information reach out to you or find you?
So our website, springfield-ma.gov. And at the top, there would be a department drop-down menu, and you would look for housing. And we're right there on that page there. They can reach Mariceli at 413. Mariceli, you want to give your direct line?
Yeah, 787-6535.
And that'll go right to Mariceli, who is our intake coordinator and does an awesome job of moving, getting people qualified and moving things right along, helping them get what they need, their income information, and getting an inspector out there and setting up our inspections and then coordinating the de-leading.
That's awesome. Mariceli, is there anything that you would like to add from your component, from your role or what have you, that you feel like the public should know? I keep saying the world, but I'm just dramatic.
Well, we are the world, that's fine. No, the thing is, we wouldn't want to people get applied to take benefit of these funding, because it really helps the kids and the family, give you improvement for the houses, even though we can give you the $5,000 over for the healthy home or the thing that is really needed in the house, give it handrails or COs or anything like it, really need in the moment, every home is qualified up to $5,000 is other rate to get in the house. The D-letting plus the extra one is, it's a great deal.
Yeah, that's very important. That's another great benefit. So it's called the Lead Hazard Reduction and Healthy Homes Grant. So HUD allows us to go in and de-lead, and whatever that costs, and then they let us spend up to $5,000 on other healthy homes type repairs. That can be ventilation in the kitchen or the bathroom, or the dryers are not safely vented, trip hazards, handrails, mold,
a lot of things.
Any healthy homes related things. They have a list of 20 different issues that we can also address, also free, other repairs beyond the lead. So it's another great added bonus to this. Absolutely.
And Mariceli also is Spanish speaking for our Latino Hispanic community here in Springfield, Western Mass. So I know she will be able to, she speaks a lot better Spanish than I do. I'll tell you right now, my Latino community, but she is there for us. And so on that respect, I want to say thank you. Before we close out the episode, I just want to ask, is there any closing marks or any friendly reminders that anyone, even Kim, if you'd like to share with the world, with anyone listening to the community?
Just to touch base on what you said, Carlos, about taking the boots off and at the door. Porches, painted porches, these old, drive down the street, you're seeing these old 100-year-old painted porches.
Yeah.
That friction of people going in and out all day. Mm-hmm. That's a huge, you might not have any lead at work and in your car, but as soon as you get home, you go up that porch, you might be bringing that dust inside. And that's part of the cleanup. In Massachusetts, you now have to do a porch floor sample of a dust wipe. Even if there wasn't lead out there, after the de-leading, they're going to make sure on that porch floor at that main entrance, there isn't any trace of lead containing dust.
That's, you know what, thank you so much for sharing that. And that makes so much sense too, especially even on the second or third floor porches, that because a lot of our homes have that, that architect, right? That style. Thank you for sharing that as well. Very important to remember, everybody, keep those porches nice and clean. We mentioned wet mopping everything. We know that works best, and keeping the windowsills dust free, and also just minimizing access to these potentially hazardous areas from our little ones. Because, it takes a village, doesn't it? It takes a village, let me tell you. All right, I think we covered great things that public needs to know, and wonderful material for everyone to share. So I want to say thank you to Kim, thank you to Mariceli, thank you to Bobby for your time this morning. I want to say thank you for your hard work in the community, and just happy Monday. Make the world smile this week.
Likewise.
And to everyone watching, to everyone listening, whether it's on the podcast app or if it's on the YouTube channel, we want to thank you for your time. We really do hope and pray that this information is useful to you, and that you can always keep it liked or saved. Don't forget to share as well, because we all need to know our rights. We all need to know where our resources are. I also want to just mention too, before we go, Mariceli and I are going to work on a Spanish episode regarding the information shared on today's episode, so that we can get that information out to our Hispanic, Latino, Latinx community in the 413 Springfield, Mass area as well. So please be patient. It's coming soon, and we have more episodes planned for you in regards to alternative sources. Hopefully we'll have some more guest speakers, and just sharing as much information as we can within our community to keep us safe, keep us stronger, and definitely keep us working hard to safer renovations and eliminating lead in our area. So thank you everyone this morning for your time. I really appreciate it.
And
have
Carlos,
an amazing day.
I think I have to plug in one more thing before.
Please. I don't think I even plugged in my services either. Thank you.
So please follow, share our Facebook page. Make sure, I'm always posting relevant lead information there, resources in Springfield. So please follow, share.
Yeah, and the Public Health Institute of Western Massachusetts sends out the newsletters as well.
Yes.
With a lot of great information regarding what we're talking about, right? And COVID-19 and statistics and what have you. So.
Yep. At
Excellent.
Springfield Healthy Homes, we have a newsletter as well. So, yeah.
Excellent. So I encourage everyone to check that out. Also, you can, if for anyone in the area, once again, I am a community health worker. I almost forgot to plug myself. I'm sorry. But with that said, you can reach me at 413-209-7608. I am at Springfield Square 1 as a community health worker. So any questions you might have, please feel free to reach out, leave a message. If I don't answer, I will get back to you as soon as possible. Once again, I want to say thank you to everyone. Is there anything else I'm missing, team, before we go?
No, spread the word.